Hi all, welcome back. Last day we had a discussion about the five critical concepts of basic cardiac life support, and today also we are continuing with the same. And thank you very much for a lot of views and supports and comments made by, and even certain people they call me also via Facebook and WhatsApp about the importance of that particular topic. So just going to begin again from where I stopped, that is the expansion of the five critical concepts. And whatever we are discussing, the five critical concept, it is based on the guidelines from American Heart Association's 2020 guidelines. And maybe years pass by, so these guidelines might change, so please do update yourself. So this is the present scenario which we are discussing. So beginning the topic, again the first critical concept, that was push heart. Now in the push heart, the adult criteria, that is meaning about the depth of compression. The depth of compression for all adult will be at least 2 inch and not more than 2.4 inch. If you wanted to have it in centimeter, it is at least 5 centimeter and not more than 6 centimeter. That is about the depth of compression, that is push heart. The second critical concept was push fast. That is about the speed of compression. The speed of compression, ideally we are representing it in two parameters. One is in the rate format and the other one is in the ratio format. When we are saying about the rate of compression for all adult victim will be at least 100 compression per minute, not more than 120 per minute. Or we can say in another way, that is the rate of compression should be between 100 to 120 compressions per minute. Even anything about 100 or more than 100, but it should not exceed more than 120. That is about the rate of compression. When we are coming back to the ratio of compression, it's about, when we say about the wet ratio, it is about two parameters. So here we are bringing the compression as well as the breathing or the ventilation. So the compression ventilation ratio will be 30:2 for all adult victim. Whether you are a single rescuer or multiple rescuer, the compression ventilation ratio, that is 30:2, will remain the same. So that is about the second critical concept, push fast. The third critical concept is allow the chest to recoil completely after each compression. So once you compressed, so you mean that you are exerting a pressure on the chest, and so the heart is getting squeezed between the sternum and the vertebra, and whatever blood is present in the heart, that will be ejected out due to your pressure, that is the compression pressure which you are exerting. So once you exerted a pressure, after exerted the pressure, that is at least 2 inch depth, you have to bring back that pressure completely off the chest. It doesn't mean that you have to take away your hands. Whatever pressure you exert on the chest, you have to allow the chest to bring back to the original position or to the normal position. So this particular process helps the chambers of the heart to refill with the blood again. So for your next compression, the blood will go out of the heart again. So again I am repeating the word again, this has to be done after each compression. So if you miss, yes, for your next compression, the cardiac output will be limited. So your compression is not effective. And the fourth critical concept is avoid excessive ventilation. When we give the breath to the patient, there is a risk that an excessive ventilation can happen. Either if you give the breath too forcefully or you give it in a more volume. In both the way there is a risk there. So what are the complications of excessive ventilation? Mainly there are two complications. One is excessive ventilation can cause gastric inflation. So instead of the air going into the lungs, it may go into the stomach. So once stomach get inflated, the pathway, that is the esophagus, the sphincter, everything also will be relaxed, especially during cardiac arrest. So there is a high risk that the gastric content can reflect back, and there is again the high risk that the gastric juice which came back to the esophagus may come to the oropharynx, and the person may aspirate that gastric juice. Everybody knows that the gastric juice is highly acidic, between a pH of 1.5 to 2.5, and that itself is enough to burn the alveoli if it got aspirated, and that it is very fatal. It's very difficult if a person aspirated gastric juice. It is very, very difficult to bring back to the normal life, because it's a fatal condition. So we have to avoid excessive ventilation. And second complication associated with excessive ventilation is, even though when you give the ventilation, if it goes to the lungs, but if it is overinflated, what happens is when more volume to the lungs occupy a more space in the intrathoracic cavity. So when it occupies a more space, it also compresses the structures of the adjacent structures of the lungs. So that is the superior vena cava, inferior vena cava, that is both the SVCs and IVCs, and it also exerts a pressure on the heart and the aorta. So especially when it exerts a pressure on the IVC and SVC, so usually the lumen will be narrowed, so the blood return to the heart decreases. So obviously when the blood returns to the heart decreases, the blood going out of the heart also decreases. So indirectly excessive ventilation can decrease the cardiac output. The last critical concept is minimize interruptions. So we know that the ratio of compression, we discussed that after 30 compression we have to give 2 ventilation. So usually if the patient is not intubated, so we have to pause the compression to give the 2 ventilation. So that is an interruption in the compression. You all have to understand one thing: whenever we are interrupting the compression, that means the cardiac output is 0. So the patient is dead again. Cardiac output is 0, means no cardiac output. So it is our responsibility that as early as possible you have to restart the compression. But giving ventilation is also equally important. But in such situation, these interruptions are, or you wanted to give a shock. Regarding shock, we will have a separate video. To give the shocking time also, you have to be all has to clear the patient, so you can give the compression. But all such scenario, the most recommended thing is avoid interruptions. Even though interruption you have to do, minimize the interruption. So the maximum interruption time is 10 seconds. So within 10 seconds, you have to restart the compression, whether your activity completed or not. In 10 seconds, you have to restart the compression. Now, this is about the explanation about the critical concept. If you have any doubts or any concerns, please do comment it in the comment box. And thank you very much for watching. And next video will come with the AED. Thank you.